Hi guys, Dr. Matt Hammond here, and we are having a birthday party because it's Chiropractic Care's birthday. And what's interesting about this is that most of you don't know, but chiropractic has never really been about back and neck pain until relatively recently in our history. So typically, the very first chiropractic adjustment that's ever done was on a man who was deaf, and his hearing was restored immediately following the adjustment. Chiropractic takes off. 20 years later, we finally get our legislation passed as a licensed healthcare provider after the great flu epidemic, where the population of Americans who went to the chiropractor during the flu, as opposed to the ones who were taking the vaccination. The people who went to the chiropractor had an incredible healing rate and immune system boosting that they didn't get the flu. That's the reason they passed chiropractic for legislation in the early 1920s. So it's just a little fun fact here. But in this video, I want to talk about something a little bit different. So I'm going to share with you my secrets to fixing painful menstrual cramps naturally. And I know as a guy, you're probably wondering, what do I know? I get that. But there are 5 natural secrets that you can do a few days before your cycle. So I'm going to give you those 5 secrets in this video. And for those of you who think there are only medications for this, I want you to consider a more natural approach, a chiropractic approach, right, during your cycle. Is I have women come in here monthly just for that. And I'll explain. Number 1, get the right nutrients. Number 2, delay those NSAIDs. Number 3, restore your spinal motion. Number 4, fix your spinal alignment with a chiropractor. Number 5, the drop table technique. So number 1, get the right nutrients. At present, we have both a prescriptive and over-the-counter drug therapy, which are used to kind of treat menstrual cramps. However, these alternative treatments can result in serious side effects. And notice I said something different. I call them alternative treatments. That's correct. Drugs and chemicals artificially suppress body symptoms. Drugs are always alternative treatments, understand? Don't forget that. We live in a backwards world. Nature remedies first. So, assuming you got your diet in check 2 days before your period, there are 5 key nutrients you need to get. Number 1, increasing your intake of calcium-rich foods like whey protein, sardines, goat milk kefir, raw milk, and white beans may help reduce symptoms in addition to supporting strong bones, healthy blood pressure levels, and proper muscle and nerve function. So number 2, increase your vitamin D3 intake. 5,000 to 10,000 daily. Number 3, eat vitamin E rich foods like almonds, spinach, sweet potatoes, and avocado. Number 4, add 1.3 milligrams of vitamin B6. And 5, your daily dose of cod liver oil, your omega-3s. Number 2, delay those NSAIDs. The possible side effects of dysmenorrhea, pain relief medications are many. And so I'll just mention just a few here. But in most cases, some women go for birth control prescriptions, and these birth control prescriptions, well, they're mainly for women who, suffer from extremely painful menstrual cramps. And you need to be aware, though, that such birth control pills, right, and other formulations can lead to blood clotting in your brain, right, your legs. And in extreme cases, blood clots also occur in the lungs and in the heart. And this can often result in heart attacks and suppression of your immune system. And when you reach for those NSAIDs or other non-steroidal drugs, right, to help with the painful cramps, and although we can't refute the fact that these prescription drugs do offer some relief for the pain, during your cramps, but we can't fail to mention, right, that they have serious side effects as well. So remember, it's not like you're using these one time a year. It's the prolonged use of these drugs, which have very poor research for long-term effects. But what we do know, they often cause women to suffer from gastrointestinal complications. And these complications can include things like gastric ulcers and internal bleeding of the intestines, and the increase in the risk of heart attacks is also another possible outcome of these long effects use of NSAIDs. Again, I recently covered 5 gut villains to avoid, where I go in more depth about what NSAIDs does to the gut. Check it out. That video applies here in our case against menstrual pains. Number 3, restore your spinal motion, which Nobel Prize winner Dr. Roger Sperry calls the windmill or the power generator to your brain. Restore your brain with tiny movement, especially all-day tiny spinal movement. Let me explain. Like any other organ in your body, a woman's sexual organs must get a proper supply of nerves from the spine. While it's true that menstruation has a close relationship with the spine because it causes severe back pain in some women, but in actuality, it is because of the movement of the spine and the neural brain circuitry it offers to the hormonal system, especially in the menstrual cycle, that chiropractic care and treatment comes into play here. Restore proper spinal motion restores the central nervous system to maximum function. Understand? So women should know that with chiropractic care and treatment, you can forget about painful menstrual cycles for good, right? And the best part is that you will never have to worry about the possible side effects from harmful drugs and chemicals that are foreign to the body anymore. So why do we recommend chiropractic care for relieving painful menstruation? And the answer is simple. Chiropractic serves to ensure that there's a proper and effective connection between your spine and your sexual organs. And this will make sure that you get a sufficient supply of nerves to your reproductive organs. So by using this method, chiropractors can help people who suffer from painful menstrual cycles. And again, if we find dysfunctional joints, adjusting the spine floods the brain with proprioception, or the brain's sixth sense, which thousands of studies have proven this blocks pain reception. So a dysfunctional joint is one that's not moving properly, or it's misaligned vertebrae of the spine, usually interfering with your nervous system, and this interference causes a massive reduction in your immune system function. So a chiropractor can reduce the intensity of pain that you're experiencing by fixing these dysfunctional joints, restoring them to normal motion, breaking down that scar tissue adhesion, and switching on the brain's sixth sense. And this ultimately provides a permanent solution to the problem of painful menstruation. So again, restoring spinal motion with chiropractic adjustment eases menstrual pain, and it is the most natural remedy for painful menstrual cycles because of its ability to restore proprioception to the brain, blocking out the pain pathways. Similar to shaking a finger after you injure it or you burn it, you rub your finger, that rubbing causes that mechanical stimulation and it floods the brain with proprioception, that sixth sense, into the brain. So feeding the brain and blocking that brain's perception of pain, this is how it works. So there are numerous studies on this pathway alone and chiropractic's effectiveness on pain management. And this holds true for both the musculoskeletal pain patterns as well as the reproductive organ pain patterns because the sensory input runs through the same central nervous system into the brain. It's as simple as that. Number 4, fix your spinal alignment with a chiropractor. Certainly, physical exercise is important. Even the physical exercises from yoga or Pilates is great. But most people don't understand the essential role chiropractic has on proper functioning spinal alignment. You're simply never going to achieve a properly aligned and mobile spine unless you're an aborigine who walks 8 to 10 miles a day from birth to the present, or regularly have your spine checked routinely by a chiropractor. So specifically, in our case against the painful menstrual cycles, right? We want to use corrective chiropractic care. And this is a technique that we employ here in our office where we restore normal curvature and spinal alignment. And it's very effective in relieving the pain during menstruation. So this technique of chiropractic treatment, by the way, is highly preferable because it helps to resolve other reproductive conditions naturally. So if you're suffering from menopause symptoms, such as hot flashes, depression, and headaches, you'll be happy to know that corrective chiropractic care can help you overcome these problems as well. So find a permanent solution to the pain resulting from menstruation by requesting a corrective chiropractor like what we do in our office here. So the realignment of the spine is also a sure, natural way of relieving joint and back pains. The fatigue and the irritability. It's also advisable to try and undergo spinal adjustments accompanied with additional techniques to your tailbone, right? And this process should be repeated for the lower back musculature. So you should schedule, by the way, this treatment in 2 phases. One is that you can have it a day before the menstrual cycle begins and the first day of menstruation. Alternatively, you can decide to schedule the treatment so that you have it on the first or the second day of the menstruation. And this procedure can help you diminish or eliminate the pain altogether, which occurs during the monthly menstrual cycles. So currently we have several patients who come to me, for 2 to 3 treatments in a row, once a month, just for this reason. Again, it's drug-free, non-surgical, natural, safe, and effective. So the 5th secret to naturally fixing your painful menstrual cycle is the drop table technique. Although several techniques are being studied to, find the best way to relieve menstrual cramps, it should be known that this is a purely physiological process that occurs naturally in all women. It is only due to the extreme pains which not all women can withstand that we look for ways to get relief from it in these ways. And according to world estimates, nearly 90% of young women experience some forms of dysmenorrhea. Similarly, 75 to 80% of these women suffer premenstrual syndrome. And premenstrual syndrome is a combination of both physical and emotional symptoms. And if we look at the drop table technique, it's a very recent development in the chiropractic world. And recent clinical studies, it suggests that the drop table technique is an excellent chiropractic treatment for dysmenorrhea. And so during this technique, the lumbosacral portion of your spine is adjusted in 3 cycles, right? So this technique is great with women suffering from other things too, like endometriosis, right? This is a chronic painful disorder in which the uterus lining tissue grows outside the uterus. And this abnormality is a constant source of sharp and severe pain, especially during menstruation. And again, we don't treat endometriosis, we are treating the dysfunctional joints. And the byproduct of restoring those joints to the normal motion floods the brain with proprioception and brain power, really, so your body can begin to heal itself naturally. The Endometriosis Foundation of America actually recommends several options, such as diet and nutrition, exercising, aromatherapy, and even chiropractic treatment. So let me just summarize, right? I just gave you my 5 natural secrets for fixing painful menstruation. And first, you need the right nutrients. And again, assuming you got your diet in check, 2 days before your period, I said there were 5 key nutrients you need to get. Number 1, increasing your intake of calcium-rich foods like whey protein, sardines, goat milk kefir, raw milk, and white beans may help reduce symptoms in addition to supporting strong bones, healthy blood pressure levels, and proper muscle and nerve function. Number 2, we talked about increasing your vitamin D3 intake, 5,000 to 10,000 daily. Number 3, eat vitamin E-rich foods, almonds, spinach, sweet potatoes, and avocado. Number 4, add 1.3 milligrams of vitamin B6, and 5, your daily dose of cod liver oil, your omega-3s. The second secret, we said, is to delay those NSAIDs. The third was to restore your spinal motion. And remember, unless you're living as an Aborigine, you're not moving enough all day long. 8 to 10 miles of walking, we said, is one way to measure that. Number 4, fix your spinal alignment with the corrective care chiropractor. And number 5, the drop table technique, which is the technique some chiropractors use to help with painful menstrual cramps. And again, although chiropractic care is primarily focused on restoring the motion to the spine and restoring the integrity of your central nervous system, the byproduct of this type of care does suggest that chiropractic treatment offers the best alternative relief for menstrual pains. So while evidence supports the use of prescriptive to achieve the same results, but with adverse side effects, right? Especially the long-term effects, then there's a safer, effective, and more natural solution. The truth is, tiny movement counts most. Your tiny spinal motion with its motion detector system is the power generator, like a windmill, to the brain to help regulate the brain, regulate your cycle, your hormones, and your body back to proper health and function. And I know what you're thinking. I thought chiropractic, but I thought it was all about back and neck pain. Nope. It's all about your central nervous system. And your brain is the supercomputer to it all. A bad back is a broken brain, and a broken brain can lead to reproductive issues, from fertility issues to painful menstruation to endometriosis pain, and on and on. Be smart. Nature needs no help, just no interference. By the way, I referred to 2 videos I did recently. You can find them on Facebook or on our website. The first video is called 5 gut-wrenching villains to avoid on depression, NSAIDs, acid reflux drugs, and the second video is called Broken Brains. Check them out. Hey, I'm Dr. Matt Hammett. Lighten up, move better, and live fuller. And listen, if you like this video, love it, share it with your friends and family.